Today I'm going to demonstrate how to properly drape a male patient with a lower back issue lying in prone. There's a couple things to take into consideration when you're having your patient lie in prone. The first is that this is a vulnerable position. My patient is unable to see me or anything that I'm doing up here, so I want to make sure that I talk through the entire session as well as provide appropriate contact so the patient always knows where I am if I have to move about the table. I also want to keep in mind that lying in prone is fairly uncomfortable, so I want to provide my modality or my treatment as efficiently as possible. This discomfort can be increased if the patient has issues with back extension or cervical rotation, as well as additional adipose tissue, breast tissue. If the patient is a female and pregnant or has high blood pressure or heart failure, you want to have them lie on their side instead of lying in prone. You also need to keep in mind culture. Some patients might prefer a same-sex practitioner, and since this is a very sensitive area, we want to do this in a closed environment, not out open in the clinic, and perhaps have a chaperone if necessary. So before beginning, I want to make sure that I arrive with everything that I'm going to need during the session so that I don't have to leave the room. I also want to come with lots of confidence so my patient knows that they're in good hands. I'm going to bring some extra pillows with me in case the patient wants one under their belly or under their legs. Put this under your legs. And I'm going to have sheets or towels to drape the patient. So since this patient is wearing shorts, not only is my drape going to serve as a protection for modesty, but as well as warmth. So I'm going to put this towel here, I'm going to tuck into the top of the patient's pants, as well as providing one on the upper body and covering their shirt. I only want to expose what I'm working on since this is a sensitive area, but it's important that it is exposed because skin-to-skin contact is very important in physical therapy. So I'm going to provide my modality, and the towels are going to ensure that I don't get any cream or ultrasound gel or lotion, alcohol, anything on the patient's clothing. I'm going to wipe away all the cream using one of the towels, remove the towel, take the shirt down, and untuck my lower towel, allowing the patient to adjust their clothing underneath the cover of the towel. When they're done, I can remove this, and we're all set.